Hello guys, so now we shall be discussing regarding the anterior relations of the kidneys. Okay, so our topic of discussion would be regarding the anterior relations of the kidneys. Now regarding these anterior relations of the kidneys, first of all what we shall do is that to know these we have got anterior relations of right kidneys, we have also got the anterior relations of left kidney, right? So if you already know near the right kidney what all organs do we have, what are relations are with these organs and all, then it is well and good, right? But if you don't know, then it is better we draw a picture and then we shall see what are the relations of these right as well as the left kidneys. So first of all, before I draw that, let me draw this intestine. So this is your stomach, esophagus, and this is your stomach, like this. And all of you know this is the duodenum, and you know better that duodenum has got many parts, right? The first part, the second part of the duodenum and all. So here we have got the first important thing, that is jejunum. So this is our jejunum. And finally down here we have got our ileum. I am drawing it short, ileum. And here you have got the appendix, this is called as your cecum. Okay, and here comes your ascending colon. So this part of the colon which I am drawing right now is your ascending colon, and this part of the colon which I am drawing right now is your transverse colon, and this part of the colon which I am drawing right now is your descending part of the colon. Okay, so for example, if I wanted to just highlight this ascending descending part of the colon, so this would be the colon here. So this colon over here is called as your ascending colon, right? And here you have got your transverse colon, and finally this part over here is your descending colon. Now all of you know very well that we have got an organ in the loop of the duodenum. So what, and by the way, let me write down the parts of the duodenum. This is called as the first part of the duodenum. This is called as the second part of the duodenum. This is called as a third, and this is called as a fourth part. So there are four parts of the duodenum, all of you know. So the first part is called as a horizontal part, upper horizontal part. Down here you call as a descending part, and next you have got the lower horizontal part, and then which is going up is called as the ascending part. So in this way we have got four parts of the duodenum. Okay, now here in the loop you have got your pancreas. So if you have to draw your pancreas, then you have to rub this part over here. Okay, so exactly here you have got your pancreas. So this is your pancreas, and all of you know very well that the tail of the pancreas is touching the hilum of the spleen, right? So this is the tail of the pancreas that is going all the way like this. Okay, and this tail of the pancreas is what? This tail of the pancreas is touching your hilum of your spleen, right? So this tail of the pancreas is touching your hilum of your spleen. The hilum is the center part of the spleen. So to avoid confusion, let me highlight this also. So this is your pancreas, right? And all of you can see very clearly that the pancreas is touching the hilum of the spleen. Now you have got the kidneys, the right as well as the left kidney. So with the red ink I am going to draw the right as well as the left kidney. Just look here. So this kidney which you can see right now is your right kidney. Which kidney is this? This is your right kidney. So if this is your right kidney, let me rub this part over here and make it clear, right? So this entire part is called as your right kidney. And in the same way, here you have got your left kidney like this. This part over here is called as your left kidney. Okay, so even let me rub out this part of the pancreas over here, right? So you are clear now, right kidney and left kidney, what is behind right kidney and what is behind the left kidney. After that, don't forget to draw the liver. All of you know where is your liver located, right? So this is the liver over here. This is the liver, right? And second important thing is that on the surface of each kidney you have got these irregular shaped glands. So these irregular shaped glands are called as adrenal glands. What are these glands? These glands are called as adrenal glands. And If you have watched my video previously on the relations, here I have already told you, right, regarding the stomach bed video, I think. So in that I already told you there are two important flexures we have got. So one flexure which is located is called as a hepatic flexure, another flexure is called as a splenic flexure, right? So if I have that picture right now, I'm going to show it to you. Yeah, this one. So this one is called as the hepatic flexure. This one over here is called as a hepatic flexure, and this one over here is called as a splenic flexure. So there are two important flexures which we have over here, right? Right. So here, okay, let me highlight this part also so that it would be easy for you. So this is your kidney. This is what we are talking about now. This is the right kidney as well as this is the left kidney. So what are the relations of the anterior relations of right as well as the left kidney? Now, if you have to write down the anterior relations one by one, let us figure it out. So let us say, what are the anterior relations? What are the anterior relations of the right kidney, and what are the anterior relations here we'll write about the left kidney? Okay, so regarding the anterior relations of the right kidney and the left kidney, the first important part near the kidney, do I have, concentrate on the right. So this is the right, this is the left. Now look at the right kidney. Do I have hepatic flexure or no? I have hepatic flexure on the right. So right kidney is having hepatic flexure. Second important thing, near the right side, what is in relation with the right? Is the liver in relation with the right kidney or no? Yes. So even the liver. Third important thing, if you look at the duodenum, which part of the duodenum is touching the right kidney, the first part or the second part? It might be the first or second. So exactly, if you look here, it is the second part. All the way from here till here is the second part. So second part is in major contact with the kidney, right kidney. So second part of the duodenum. Second part of the duodenum. The fourth important thing, obviously on the top of right kidney we have got right adrenal gland. So here we have got the right adrenal gland. So these are the four important relations of your right kidney. Now we shall look at what are the important relations of your left kidney. The first important relation, if there is hepatic flexure on the right side and on the left side, what flexure will be there? Splenic flexure. So we have got splenic flexure. Okay. Second important thing is that we even have got the body of the pancreas. Okay, so you can see the pancreas here. Only the last part here is called as the tail of the pancreas, and this is called as the head of the pancreas, and the middle part entirely is called as the trunk or the body of the pancreas. So this entire body of the pancreas, not entire, the last part of the body of the pancreas is in connection with the left kidney. So the body of the pancreas. Body of the pancreas. Second important thing, if you look at the spleen, guys. So exactly speaking, the inferior surface of the spleen is in contact with the kidney, right? So actually I have to draw the picture of the spleen little bit above in the sense I have to draw the spleen here till here. Okay, if I draw the spleen here, then the inferior surface will be the border of the left kidney, right? So just remember it, inferior surface of the liver, inferior surface of spleen, not liver, of the spleen. And obviously when there is a right adrenal gland, there should also be left adrenal gland. Left adrenal gland. Okay, so whatever so far we have discussed, guys, all these are what? The anterior relations of the kidneys. So once again, in the anterior relations of the kidneys, there are quite many interesting things you can see here. First is you have got the right adrenal gland, next you have got the inferior surface of the liver, right, and here you have got the second part of the duodenum as well as the hepatic flexure. And on the left side also you have got the body of the pancreas, you have got the left adrenal gland, you have got the inferior surface of the spleen as well as the splenic flexure. So these are the most important anterior relations of the kidneys, guys. So thank you so much for watching my video. Goodbye.